Wow, this is extraordinary. You know, I've devoted my life to working on something called neglected diseases, where you're lucky if you can get 12 people in a room to listen. And so to have this is, it's a bit overwhelming. I never thought it would happen. It's like one of those dreams you have when you drink too much red wine the night before. And my wife, Ann, would say, shut up and go back to sleep. And after I tell her about it, but thank you. Thank you for making this happen. I'm so happy to be here with everyone, including Governor Castle, John Edward Porter, recipient of the Legacy Award, and Research America Chair Emeritus. I'm really excited to see so many mentors here. I mean, Anthony Fauci and Roger Glass and Francis Collins is just, that's amazing. And most amazing of all is the team that Mary Woolley has assembled here at Research America. What an incredible national treasure she is, and the organization. Thank you. I want to accept this on behalf of our extraordinary team of scientists committed for new solutions to address poverty-related neglected diseases. I won't speak very long, I promise. Just to brief, since you don't get 500 people in a room to listen to something about neglected tropical diseases, I'm not going to lose this opportunity. We call them the NTDs, neglected tropical diseases. And to explain that, I want to take you back to the 1990s, when more than 1 billion people lived on no money and seemed destined to remain trapped in poverty. But in 2000, a new set of Millennium Development Goals were created so that for the first time, governments recognized that improving health could reduce poverty, and perhaps the boldest goal of all was what was known as Millennium Development Goal number 6, MDG 6, that specifically targeted HIV, AIDS, malaria, and other diseases. And in response, our government launched new approaches to place people on antiretroviral drugs in unprecedented numbers, and a lot of people in this room are responsible for that, as well as anti-malarial drugs, and creating the President's Emergency Plan for AIDS Relief in the Bush administration, and the President's Malaria Initiative, and then supporting the Global Fund. But there was a problem, and the problem was this, that if you remember the goal, MDG 6, it was to combat AIDS, malaria, and other diseases. And believe it or not, nobody really stood up for something called other diseases, right? We didn't have Bono standing up there saying other diseases. And so it was quickly apparent to those of us who had worked on other diseases that no one was going to champion these conditions. And ultimately, the advocacy and public awareness fell on us, a tiny group of scientists, including 2 British colleagues, and myself, who were passionate about diseases such as hookworm and schistosomiasis and leishmaniasis and Chagas disease, or as I like to call them, the most important diseases you've never heard of. And in response, we designated the other diseases as NTDs, neglected tropical diseases, noting that these were in fact the most common afflictions of the world's poor. The point being, every single person living in extreme poverty, all of the bottom billion, were infected with at least one NTD, and as a result were too sick to go to work, experienced horrible pregnancy outcomes, or suffered terrible reductions in intellects and cognition if you were a child with NTDs. And we championed this, what we call a rapid impact package of medicines that could be delivered for 40 cents a person per year, practically free, because many of these medicines were being donated by the pharmaceutical companies, including some represented here tonight. And we worked with the US and the UK governments through USAID and their British counterpart, DFID, the British Department for International Development, to provide funds for these packages. And as you heard, a global network for NTDs began in 2006, and now a decade later, we can see the results. Today, the World Health Organization estimates that more than 1 billion people have received these medicines, 1 billion people. And the new studies from the Global Burden of Disease initiative sponsored by the Gates Foundation in Seattle estimates that the prevalence and disability of these diseases has decreased by 1/3, to the point where we can envision one day eliminating these diseases. But we still have a lot of work to do. For many of the NTDs, we need better technologies, including vaccines. So our team began to develop new vaccines for the NTDs. We call them the anti-poverty vaccines because of their ability to not only improve health, but also eliminate these poverty-promoting effects of these diseases. In 2011, our nonprofit product development partnership relocated to Baylor College of Medicine and Texas Children's Hospital to expand to the point where we're developing now at least 6 anti-poverty vaccines, with 2 of them for hookworm and schistosomiasis in clinical trials, while ones for Chagas disease and leishmaniasis are in the pipeline. But we're also building capacity, because it turns out that very few countries know how to make vaccines. So we're building capacity in the Middle East, Southeast Asia, and Latin America to teach others how to develop NTD vaccines. And working with me in this endeavor is my colleague of almost 20 years, Dr. Mary Elena Bottazzi, who's also here tonight. Thank you, Dr. Bottazzi and Mary Elena. Our hope is that one day all of the bottom billion will have access to this new generation of vaccines. So tonight, I want to thank my Baylor and Texas Children's colleagues, including Paul Klotman, Dr. Paul Klotman, the Baylor president and CEO, is here tonight, as well as Mark Wallace and Dr. Mark Klein from Texas Children's. Beyond the diseases of poverty abroad in Texas and elsewhere in the southern U.S., we have also found a surprising depth of poverty and neglected tropical disease transmission. So one of the things we did when coming to Texas was to take that global health lens and turn it inward on the southern part of the United States. We now estimate that there are 12 million Americans who live in extreme poverty or are infected with at least one neglected tropical disease. And this has been one of the hardest advocacy efforts of all, getting people to care about the poor and disenfranchised right here at home. And still another emerging threat we face is an anti-vaccine movement growing in number and strength day by day. They allege vaccines cause autism, but as both a vaccine scientist and autism parent, together with my amazing wife Ann of 30 years and my mother-in-law Marcia Fryfield is here tonight, we know that vaccines don't cause autism. The science is clear, and yet thousands of children in the U.S. are being deprived of their life-saving vaccines. Thank you. They're being deprived of these vaccines while measles epidemics rage across Europe and have begun here. We now have almost 100,000 children in Texas not receiving their vaccines for entirely phony reasons. And writing and speaking about how vaccines did not cause my daughter's Rachel's autism has been one of my toughest fights yet. The anti-vaccine lobby is strong, aggressive, well-organized. They're bullies. And I especially appreciate the endorsement and support of Research America in this next phase of our journey in science and public engagement. Thank you. While anti-science may be on the rise in America and in Europe, together I think we have the tools to defeat it and reaffirm the ascendancy of science in America. So Mary, thank you again for this incredible honor and opportunity. Thank you.